Hello, everyone. I'm Dr. Malak from Disc Center of America. We have patient Joseph Mahoney, and he went for the knee decompression and the class 4 laser. And we would like to share his experience about this treatment. Good morning, Joe. How are you?
Morning, Doc.
Good. Can you share with us, please, what did you feel before you start the treatment for the knee decompression and the laser, and how it affect your conditions?
When I first came in, I don't know if the camera can see this leg. This leg doesn't bend. This is back from 1997. It's been like this. This leg I blew out in 2019. Told me I needed a replacement, and I didn't want another surgery. So I took the pain. I got it cleaned out. Took the pain for now 5-6 years, and I started here in December. I couldn't sit like this, not without being in pain the whole time, and now I'm sitting like this, no pain at all. I mean, I get tired, I get sore at the end of the day, but I'm working on building a leg again. So, yeah, I highly recommend it for anybody. I mean, if you don't want to get surgery and you can do it, this is a leg that I couldn't do this 3 months ago, 3.5 months ago, without it being extreme pain and not nowhere moving this fast. So I'm very pleased, and the people here are great too. Doc's great, therapy, the aides and everybody are great. So I don't know. It's a good place, it's a good thing, and I'm gonna keep up with it. That's for sure. So
Joe, what you recommending for patients? They've been told they have severe arthritis. They went to the surgeon, and the surgeon asks them to do the knee replacement. So, what's your recommendation for a patient like that have knee pain, severe arthritis?
I highly recommend this. I was told that the only way to make the pain go away was to get the replacement, take the intense rehab. Obviously, with a leg that doesn't bend, trying to do a knee replacement rehab, like it's different here, you treating me because I can only bend on one side, and the pain's gone. So there's no way I can't recommend this to someone. I mean, like I said, not 100%, but I wake up, it's not sore. At the end of the day, depending on my day, it might be sore. So sometimes no, and I just go to bed normal. Other times it's sore, you get the little throbbing, but otherwise, oh my God, I couldn't be more happy with my results. So
That's great. So, you're glad that you find our office, and
yeah,
we change your life, and we make you enjoy free pain life.
yeah, that's what I'm hoping for. Right now it's headed in the right direction. So can't ask for more at this point. 3 months in, and I'm feeling good.
That's great. I'm glad we changed your life. I'm glad you got the result you was expecting, and I'm very happy for you. And thank you.
Thank you, Doc.
You're welcome.
Thank you.
Okay, hello everyone. My name is Dr. Malak. I'm from St. Teresa Physical Therapy and Disc Center of America. We have a patient, Jason Poyer, and he came to our office with back pain, numbness, tingling down his legs because he has multiple disc bulge and herniation in his lower back, and would like to share his experience about the treatment in our office. He got spinal decompression DRX 9000, he got the laser therapy, and he got the physical therapy. How are you, Jason?
I'm doing good. How you doing?
I'm good. So would you like to share with us what's with your symptoms before you come to us, and how the treatment affect you?
Yeah, so in March I couldn't walk because my back hurt so bad I had to get hospitalized. But I came home from the hospital and I came to you guys, and like almost a few weeks into it, I was pretty much out of pain, and like I haven't been in pain since I started the treatment. Whatever, it's been about 6-7 months now. So very happy, was satisfied with the treatment and the service.
Okay, but when you came to us, you had the pain down your legs, you had the numbness, and
Yes.
How is that now? How do you have any numbness, any tingling, any
No,
pain?
I had some numbness in my lower back and my legs, and it's all gone now. It really feels really good.
So how much improvement you got with
Oh.
with the spinal decompression and the treatment?
I was like 100% improvement. It's like night and day.
Wow.
Yeah.
So what's your recommendation for patients similar to your condition? And they go to the doctors, and the doctors, the first thing they tell them, you need to do surgery. What's
That's
your...
what they told me.
That's what they told you.
Yeah.
And they tell a lot of our patients the same thing. So what's your recommendation for patient like that?
Oh yeah.
You know, they're being recommended to have surgery.
Definitely give this a try first. That was another great thing, is like I didn't have to have any downtime off of work for recovery for surgery. I was able to continue working while doing this with you guys.
That's great.
Yeah,
That's great.
that is awesome.
So I'm glad that we changed your life, and we put a smile on your face.
Yeah,
And I'm glad that you improved as I expected. And thank you so much.
yeah, thank you.
Thank you. No problem. Hi everyone. My name is Dr. Malak. I'm the owner of St. Teresa Physical Therapy and Center Reach Disc Center of America. We have patient Jalba Patel. She came to our office with multiple disc bulging and herniation in her neck and her lower back. And we did the spinal decompression DRX 9000 with physical therapy and laser. And we would like to share her experience about the treatment we performed in our office. How are you, Jalba?
I'm doing good, thank you.
So I would like you to share what was your symptoms and for your neck and your back because of you have the disc herniation and disc bulge in your neck and your lower back, and how the treatment in our office between the spinal decompression DRX 9000, between the laser and the physical therapy, how it affect your condition.
Okay, so a couple months ago, I've been suffering so much pain with my neck, with my back, on side, right side. There was a lot of pain because I couldn't even sit up or sleeping or get it in the car or get it out from the car. There was a lot of pain. I cannot even walk out, even though I cannot pick up my medicines. So that's how I was bad. And then when I heard one time on Facebook, there was the St. Teresa physical therapy had a video on it. So I see that and I'm like, okay, no, this is what I needed. So, and I come here with, first I went to the orthopedic and I got the script. So I come with script here and then I asked Dr. Malak about my pain, and then I got to understand that this is what the spinal decompression treatment, the physical therapy including. So that's what I have it. And in my first session, I was surprised. It was so helpful for me. I was able to walk, I was able to sleep. That was so nice to me. And day by day, after one and second, it was improving little by little. That was so awesome. And I'm still continuing on with it. I finished my 30 sessions with my back, with my neck, because I already have damaged the 4 disc on my back and my 4 disc on my neck as well. So I was so bad, it was painful, I was almost like dying condition. So, but that was so awesome that this is really helpful for me. I'm really relieved. I'm doing everything right now. I'm going out, I'm walking, running, everything I'm doing right now. So it's really helpful for me.
So
And
how
I'm
much
still on.
improvement you got so far?
I can say 95%, and there is another plan, which is the maintenance. I'm continuing doing that's every month, which is really helpful me. Even this little bit, maybe something here and there, it's helpful to continue go on with the healing process. So I'm really grateful with this.
So what is your recommendation for patients in situation like you, but they went to the surgeon and the surgeon says you have to go for surgery, and what's your recommendation for a patient like that?
I have a recommendation for everyone to go for the decompression treatment first, because the surgery, they're not fully helpful for always. So for everyone, so I recommend to the decompression treatment, which is I really happy with it. I'm glad that I didn't go to surgery, because even though they don't recommend surgery first, so you have to go through the physical therapy or the decompression treatment. So I'm really grateful with that.
Good. So I'm glad that we changed your life, and we, now you're enjoying free pain.
Yes.
And glad we put a smile on your face. And thank you so much.
Thank you so much.
Everyone, my name is Dr. Malak. I'm from Center Rishi Disc Center of America. We have patient Costantino. He came to our office with multiple disc herniation and bulging, severe pain in his lower back, and numbness tingling down his legs. And after we finished his spinal decompression treatment with him, we would like to share his experience about the treatment. How are you, Mr. Costantino? If you would like to share with us what the symptoms and the signs you had before you come to us, what did you had before the treatment, and how the treatment affect your conditions? The spinal decompression, DRX 9000.
Well, before I come, I feel a lot of low back pain, almost 10 to 10, and after I feel I can move, even my legs. Before I have a lot of pain, and after I come for the spinal decompression, it's the pain go away, and I'm alright. I feel good.
Do you have any numbness or tingling down your legs now?
No, nothing at all in the legs. Before I have a lot of numbness.
And tingling. Okay, what about your pain? Do you have any pain in your lower back right now?
No, nothing.
So how much improvement you got after the spinal decompression?
I feel 100% better.
So what's your advice, Mr. Costantino, for patient suffer from the same condition like you, before they go to surgeon and before they jump into a surgery? What they should do first?
To come to Dr. Malak for the spinal decompression.
Okay. Is the spinal decompression, it changed your life?
Of course, change your life.
Are you happy
I'm
that
very
you
happy.
got that treatment?
Yeah, I'm very happy.
Okay. I'm so glad that we was able to put a smile in your face, and we change your life, and we make you enjoy a life free of pain.
Thanks, doctor. That's very good.
Thank you.
Thank you.
Okay, good morning, everyone. I'm Dr. Malak from Disc Center of America. We have patient Joseph Ramo. He came to our office with severe osteoarthritis. His knees was bone and been told he's gonna need knee replacement. But he found our office, and we did knee decompression and the class 4 laser. And we would like to share his experience with us today. So good morning.
Good morning.
Joe. How are you?
I'm well, thank you.
So I would like to, if you share your experience about what the symptoms you had before you start the treatment, and how the treatment it changed your condition and it affect your life.
Okay. Good morning. It's an amazing experience to me. I've hurt myself. I'm in 68. I've hurt myself from high school football. I've played rugby in Europe. I've hurt my knee a number of times, and I'm good with pain, so I've never really, when I was younger, fixed it the way I had. As I got older in my 40s, I started hurting, couldn't walk as well. I went for an operation, and I ended up 2 on my right knee, 1 on my left, and it didn't help. I have been struggling since then for the last 15 years, and I've been to physical therapists, at least 4 or 5, maybe even 6 of them, now that I'm thinking about it. I've been to chiropractors, a number of them. I've actually just recently finished, about a year ago, the needles are, I'm getting old, I'm sorry, acupuncture, and that didn't help. My wife had sciatica really bad, and she went to this doctor now, does MMO, and it helped her, so I tried it, and it didn't really help me. So I, talking with my regular doctor, he recommended a surgeon, we talked, and he told me I need knee replacement, and I was almost this close to listening to him because the pain was getting that bad. I would say, let's say I walked around the block. It was getting so bad that I walk all the time with my wife when I was younger. The last time I would walk and she'd zigzag the whole, and I couldn't stay ahead of her. I was in pain. I'd get back from just going around the block and my knee would swell. So I was really contemplating taking a knee surgery and doing a replacement. I actually asked for a couple doctors. I went for a checkup, or to see what they thought, and I ran into an ad, and it was Dr.
Malak.
Malak. Sorry, Dr. Malak, and I tried it. I'm not even fully through it, and from the second week, I'm gonna say maybe 4 times in, it was amazing to me because the hardest thing is the pain, and it was like I was on drugs. I've taken drugs, and that's what scares me, that the pain wouldn't be there, but my knee would still hurt. After the second week, the pain went away. I am like, I feel like I could dance. I know when I push myself, I can still feel the knee is not right yet, but I'm only halfway through, and we've talked about that, and he said when I'm fully done and do the PT, I should be excellent. All I can tell you is, I don't know how it does it. I just know that I come here 2 to 3 times a week, sometimes 2, sometimes 3. And one last thing I would like to say, last week here on Long Island, we had a really bad snowstorm, and I really thought this was a test because I missed the I did Monday. I missed 3 other sessions. So it was from Monday to Monday, a whole week gone by before I was able to go again. And I thought that was gonna make everything go back to the way it was. And I still felt not a problem at all. It's like, I know it's getting better. I know that I'm not in pain. I wish I could tell you, that I wish I could say, see, but I can tell you, it's amazing to me. It is. I wouldn't do this if it wasn't true. I know that I'm looking forward to the next half, and I can't wait to go walking fast with my wife again.
So, I'm glad that you only even half the treatment, and you already experience no pain. You experience, getting more range of motion, and you're walking a lot better, and your life being changed. So, what's your recommendations for patients being told they are bone and bone, they need knee replacement, and what do you recommend to these patients before to make that decision about surgery?
I would recommend it highly. I can't explain it except that it worked for me. If it's great, I have no pain. That's the best thing that I can say right now. I would recommend the red light and the knee decompression unequivocally.
All right, and I'm glad that we did change your life, and you are getting the result you was expecting, and and I'm so glad that we put a smile on your face, and we make you enjoy free pain of life.
I recommend it. It does. It's true. It has been. It's true. I believe it very strongly. I know it worked for me.
Thank you so much. Thank
Doctor,
you.
thank you.
Thank you.